back again to talk about the Ebola virus, which is mysteriously getting more and more confusing with every day passing. I'm just going to talk about Nurse Nina Pham for a minute because this is the second person to be infected in America. In America. The first Americans were Dr. Kent Brantley and Nancy Righty Bowl. They were the first Americans to bring the disease to America. But the first Americans to be infected to infect someone else in America is Thomas Eric Duncan and Nurse Nina Pham. Texas's second Ebola patient has been identified as 26-year-old nurse Nina Pham. The deadly virus passed to Pham while she was treating Thomas Eric Duncan at Texas Health Presbyterian in Dallas. Duncan died last week and Pham was sent into isolation on Friday. The Center for Disease Control and Prevention confirmed last week that an unidentified health worker who had direct contact with Duncan had been infected. During the initial discovery, the CDC and officials at the hospital protected the worker's identity. Quick question, why would they protect that person who has been infected identity? They didn't protect Thomas Eric Duncan's identity. The nurse's name was discovered by Yahoo News after a public records and state nursing database search was conducted. On Monday morning, Nina Pham's family confirmed she was the nurse being treated for Ebola. When Thomas Eric Duncan was admitted to the hospital, more than 50 people came in contact with him. However, only 10 people were placed on a high-risk watch list. The Ebola virus featured a 2 to 21-day incubation period. The disease, which is only transmitted through bodily fluids and what is contact? Bodily fluids is contact. They went out of their way to specify the difference between bodily fluids and contact. Let me go on. Is only transferred when someone is showing symptoms from the disease. So it's only transferred when someone is showing symptoms of the disease. Key point. Nina Pham marks the first time that the Ebola virus has been transferred between two people in the United States. Nina graduated from Texas Christian University in 2010 and has worked as a nurse since 2010. The CDC and other agencies have recently stated that the virus was likely passed by way of, get this, of a breach in well-established handling protocols. Further details about Nina Pham's contact with Thomas Eric Duncan have not been released at this time. CDC Director Tom Frieden said on Monday that he wouldn't be surprised if another hospital worker became ill. Unfortunately, it is possible in the coming days we will see additional cases of Ebola, Frieden said in a press conference on Sunday. This is because the healthcare workers who cared for these individuals may have had breach of the same nature. Now let me stop right there. This whole breach of protocol, you know what this means? This means if I'm caring for a patient in protective gear, I perhaps take my protective gear to, clean something up that they saying, well, could you get this? And you feel you can't really get it with the protective gear on, so you take your gloves off, you take this off, and you clean it. But haven't they been advised to handle that the appropriate way? And also, since she just became a nurse, she doesn't have the experience of dealing with Ebola. Wouldn't she get her superiors to deal with whatever case she had to breach handling protocols for? The term breach in well-established handling protocols basically means she handled something the wrong way. She mishandled something. Perhaps a blood sample. There was a blood sample. She dropped it. It spilled, and then the blood landed on her lip, or it landed in her mouth, on her eye, in her eyelid. It seeped into her eye. It seeped into her mouth, mixed with her saliva. Next thing you know, she gets infected. Or perhaps she cut herself accidentally, dealing with the patient, his vomit, his diarrhea, what have you, mixed with that cut, and then all of a sudden she gets infected. But if that's the case, why didn't they feel the need to explain that, as opposed to saying a breach in protocol? Wouldn't it have been better for Americans to know how exactly this disease is contracted? Wouldn't that have been a perfect example to say, well, Nurse Nina Pham mishandled a blood sample, it spilled, it landed on her lip, speckles landed in her mouth, and therefore she got it. Isn't that advising the American people of how in depth how this is contracted? bodily fluids or saliva, blood, even plasma, germs carried on to another person through way of mouth. They didn't explain that. Her infection is a mystery. Now we also have another person who has just been infected. This person's name is Amber Joy Vincent. She has been infected, I assume, by Nurse Nina Pham, because if she was infected by Thomas Eric Duncan, then they would have announced that she was infected around the same time, right? So apparently she got infected by Nurse Nina Pham. How did she get infected by Nurse Nina Pham knowing that Nurse Nina Pham was infected? Oh wait, let me back up. Let me slow down a little bit. Maybe she didn't know at the time. Then she started showing signs of being infected. Which is, what? 4 days later? Nina Pham was infected October the 11th. Amber Joy Vincent apparently was infected October the 15th, because that was the day it was released. But perhaps she was infected before, and then, probably 2 days earlier, and then they, announce it now. Due to the, making sure that she's infected, right? So let's say she was infected and diagnosed on October the 13th. Thomas Eric Duncan died prior to those dates. So we can't say that Amber Joy Vincent got infected from Thomas Eric Duncan, because she would have came around the same time that Nurse Nina Pham got infected. It seems she was in contact with Nurse Nina Pham, and she got infected by Nurse Nina Pham. Now let me present this also, because this is a different approach to this disease all of a sudden. The disease, which is only transmitted through bodily fluids and contact. So this means just touching someone with the Ebola virus, you get infected. Is this what they're saying? That's what contact means. That's not the same as bodily fluids. Bodily fluids are saliva, blood, So you're getting infected by just touching the person? This is fear-mongering. This is all this is. Fear-mongering. We want to cause fear to help the pharmaceutical companies make billions of dollars, which regenerates our economy because we owe other countries. So we're going to sacrifice our own citizens to fool them, to manipulate them into buying these expensive drugs to stave off in my opinion, a boogeyman disease. Because I don't even think anyone is infected in this country. I really don't. I don't believe Ebola is even here. I believe it's created, and once you create something, people become paranoid. I have Ebola. Oh shit, I'm sneezing. I have the flu. I have the Ebola virus. Let me go get checked out. Unfortunately, ma'am, sir, you have been diagnosed with Ebola. Oh my god, oh no, I'm gonna die. No, calm down. We'll give you these drugs for $1,000. Pay $5,000 for these drugs and we will save you. I don't have $5,000. Well, unfortunately, you will die. Oh, let me see what I can do. Take some money out of my savings account. I will save that for a rainy day. Let me do what I can do. I need to survive. I don't want to die. I have a family. I have children. Exactly, ma'am, sir. You don't want to infect your family members also. Have them come in also, and we're going to get them on these drugs too. Do you have Obamacare? They'll help you pay for the cost. Oh, you don't have Obamacare. Well, see what you can do. Just like a loan provider in college. They call you trying to collect a certain amount. Do you have $1,000 you can pay on your loans today? No, I don't. Hang the phone up on you. Oh, well. Well, I can pay something. No, we want $1,000. Do you have $5,000 you can pay on your loans today? No, I don't have $5,000, but, I can pay $150 a month. No, that ain't gonna work. We need $5,000 right now. The Ebola virus is a money-making strategy. A sinister strategy to create fear, and once you create fear in the minds of Americans, since we are the most gullible people on this planet, we'll fall for anything. We don't research, we don't educate ourselves on anything. Even with the information out there in the media, not in the media, through sources of whistleblowers telling you that these things are fear-mongering tactics to drive you crazy to spend money on drugs that they've just been sitting around waiting to give to you at high expense. You don't listen to those people. You don't educate yourselves on those things. So what happens? Out of your fear, you go spend gazillion dollars on these drugs that actually cause the symptoms of the very so-called disease that they're treating you with. Doesn't that sound familiar? Sounds like AIDS, doesn't it? People were treated for AIDS. Then they were hooked on those drugs that actually killed them. It wasn't the AIDS that killed them. It was the drugs. Have you ever watched the commercials that say, has your child been prescribed Risperdal or Xonify, bloating, male breast enhancement, respiratory failure. That's what the drugs cause, not the disease. The drugs are causing that. I'll be back.